Dialysis is not just a medical procedure, it is a lifeline for those suffering from kidney failure. The looming price hike has left many Guineans who already struggle to afford the previous cost fearing for their lives. The Association of Fellows with Renal Disease say their members cannot afford the 380 cedis, let alone twice that amount.
Government to look at the tax component on these consumables is to try and scrap it off so that when they bring these consumables, it will go down, and then we the patient we can pay maybe realistic price, because once you put the charges on it, it will go up, and when they bring it to us, we cannot pay.
As the cost of dialysis seems to be on the rise, so does the potential human toll.
Me, for instance, most of the time when I'm going for dialysis, sometimes I get to the hospital before 3:30 a.m. Sometimes it's very an uncomfortable situation because the dialysis process takes 4 hours. So imagine you get to the hospital and even one person comes before you, the number of hours you have to wait. So it means that you have to wait 4 hours for the person to finish. Then you also go on the machine for 4 hours.
Patients who rely on these life-saving treatments find themselves grappling with the increasing financial burden, prompting fears that affordability concerns may lead to adverse health outcomes or, in extreme cases, the loss of lives. On the other hand, the management of hospitals, in their pursuit of health first, find themselves entangled in a financial quagmire. The subsidy extended to patients has plunged, for example, or case in point, the Kolebu Teaching Hospital into debt, a whopping 4 million cedis to their suppliers.
If you look at the 380 that we are currently charging, by the time of instituting that price, it was 380 equivalent of $100. So the $100 translated into 380 cedis. The cost of the consumables has not changed in terms of dollar terms or in euro terms. It hasn't changed. What has changed is the exchange rate. So if we are to use that analogy, that 380 was $100, then $100 now should be about 1,200 or 1,100 and something.
That's not all. Even though the cabin dialysis center was close to outpatients, they also saw emergency cases which led to a monthly loss of 200,000 cedis.
From May till we opened to the outpatient, every month, Kolebu lost over 200,000 cedis for the emergency dialysis sessions that we were doing. Every month.
It is worth noting that about 250 patients attending the dialysis center did not pay for treatments as private organizations financed the cost of dialysis.
We have a group that came in about 5 years ago, the First Sky group, that pledged to pay for the dialysis for about 250 people in a month. And they were paying 1 million cedis every quarter. And that was able to do that. That was the 380 era. Over time, exchange rate changed and the prices of things. Now the difficulty is that the other facilities, the First Sky group, did not have these agreements with them. So if you go, it means you have to pay out of pocket. And that was where the problem started. Because people were used to getting it free from Kolebu. They're paying nothing.
In response to the public outcry and the financial strain on patients, the Ministry of Health announced plans to absorb the financial burden of dialysis treatment. The National Health Insurance Scheme is set to cover expenses of card-bearing members, alleviating the out-of-pocket expenses for a significant portion of the population.
If the nation wants to push that under health insurance and we need to pay more, let us begin the discussion. What I will not wish for is that we say go under health insurance and it collapses the health insurance scheme totally.
But what is the true cost of a dialysis session? To understand the true cost of dialysis, it is essential to delve into the various components contributing to the overall expense of this medical intervention. For the purpose of this report, we're going to zone down to two parts, that is, non-drug items and other charges. Non-drug items include the dialysis kits, which currently cost 508 cedis 50 pesos, normal saline 10 cedis, gauze packs 10 cedis among others. Some other charges include a 58 cedis consultation fee and maintenance fees of 30 cedis. The grand total of dialysis per session according to this budget is around 765 cedis 42 pesos, which is on the low side of things. Other computations go all the way up to 1,685 cedis per session. The true cost of dialysis in the country extends beyond monetary figures. The human impacts and the delicate balance between accessibility and affordability. As government takes steps to address these challenges, it is crucial to continue the dialogue on sustainable solutions that ensure the well-being of fellows living with renal disease, while also navigating the complex landscape of healthcare economics in the country. Emmanuel Samani, TV3 News, Accra.